Good afternoon. Welcome everyone. Thank you for joining us on our final webinar. We are pleased to present this final school wellness policy webinar. Remember, this series has been developed in hopes that you will be able to use this information to revise your school wellness policy. All of the recorded webinars are available on the NDE website under Nutrition Services, Team Nutrition, School Lunch Program, and Wellness. You can also email any questions that you may have directly to Zainab Rita, who is the Team Nutrition Director, at Zainab, zainab.rida@nebraska.gov. The outline of today's webinar includes providing a summary of all the 7 previous webinars, introducing the final provisions to evaluation and monitoring, identifying best practices regarding this element, highlighting some of the administrative review questions and some possible answers, and we will share some great team nutrition resources to help schools to evaluate and monitor their school wellness policy. And I finally will include next steps on revising your wellness policy and how you can go about this with assistance from many different people. As you all know, on July 29, 2016, USDA finalized regulations to create requirements for a written wellness policy by local education agencies, or LEAs. The final regulations require developing a revised local wellness policy during the 2016-17 school year and full compliance with these regulations by June 30, 2017. New regulations require districts to include all 8 elements: public involvement, nutrition guidelines, nutrition education, nutrition promotion, public notification, physical activity and education, and monitoring and evaluation. So we have addressed all of these elements. The first was the element that indicates that each LEA must allow parents, students, representatives of the School Food Service Authority, PE teachers, health professionals, school board or school administrators, and the general public to participate in the development, implementation, and periodic review and updating of the local school wellness policy. Final rules of the nutrition guidelines require LEAs to include nutrition guidelines for all foods and beverages available to students on each participating school campus during the school day. Ensuring that policies provide guidance on foods and beverages available for sale that is consistent with regulations governing school meals and competitive foods for sale in schools. It also encourages districts to establish standards for foods made available but not sold during the school day on school campuses. The webinars have highlighted the final nutrition education rule, which requires goals for nutrition education and promotion that promote student wellness. In developing these goals, LEAs must review and consider evidence-based strategies and techniques that link education with the school environment. The series has introduced nutrition promotion and how LEAs are required to include goals for nutrition promotion to improve the nutrition environment. We have also discussed the final provisions for physical education and physical activity. Local education agencies are now required to include goals for physical activity, PE, and other school-based activities to promote student wellness. Last week, the information was shared on public notification. The final rule indicates that LEAs must inform and update the public about the content and implementation of school wellness policies. Today, we will be focusing on the last element of the school wellness policy, monitoring and evaluation. The final rule requires state agencies to assess compliance with the school wellness policy as part of the general area of administrative review, which is every 3 years. LEAs conduct an assessment of the wellness policy every 3 years at a minimum and will include a determination if the compliance with the wellness policy is being made, how the wellness policy compares to other model wellness policies, progress made in attaining the goals of the wellness policy. And for documentation needed, the state agency will examine records of during the administrative review that would include your current wellness policy, documentation on how the policy and assessment are made available to the public, the most recent assessment of implementation of the policy, and documentation of efforts to review and update the policy, including who was involved in the process, how stakeholders were made aware of the ability to participate, and meetings that were held. Here are some examples of policy language to help meet the monitoring and evaluation component. The district will compile and establish an annual report to share basic information about the wellness policy and report on the progress of the schools within the district to meet the wellness policy guidelines. This report will include, but is not limited to, the address for the wellness policy or website, and how the public can receive access a copy of the policy, a description of each school's progress in meeting the wellness policy goals, and information on how individuals and the public can get involved with the district or school wellness policy. Here are a couple of questions that will be asked during the administrative review. When and how frequent does the review and update of the local school wellness policy occur? The second question, how is documentation provided to support the response or an appropriate website that links the public with the school wellness policy? Here are some examples of responses to these questions. At least once every 3 years, the district evaluates compliance with the policy to assess implementation of the policy and includes the extent of which schools under the jurisdiction of the district are in compliance with the policy, a description of the progress made in attaining the goals, and the position or person responsible for managing the triennial assessment and contact information. The person should be listed with their title and their contact information, that it can easily be found in the wellness policy and on the wellness policy website. The district wellness policy, in collaboration with individual schools, will monitor school compliance in this wellness area. The district or school will actively notify households and families of the availability of the triennial assessment and progress report. Education agencies must also formally address that their policy ensures goals and objectives are met. So, to do this, local education agencies must develop measurable activities and objectives to help with monitoring and evaluation of the wellness policy. And your objectives should include the 5 WH questions. What are you going to do? Who is going to be responsible? When do we want this to be completed? How are we going to do these activities? It's very important to include an indicator to measure your success. This can be done by setting a percent or number as a benchmark to compare before and after and implementing a policy. And I will share with you an example in the next slide. Usually your objectives should include by how much percent, number, how much your measure of your success. Let's take a look at this objective. By May 2017, we will increase PA or physical activity for students by 60 minutes per week by offering physical activity breaks in the classroom. So increasing the PA is the what? By May 2017 is the when. The how is offering PA breaks in class. School is the who. And the 60 minutes per week is the how much. Schools can do this a number of ways. By evaluating health trends through fitness testing or nutrition habits and surveys, assessing time spent in physical activity or in PE, and tracking many nutrition education programs over a certain time period. Also, evaluating the financial impact and monitoring a la carte sales in the cafeteria can be effective ways to assess and evaluate compliance. This document can help schools with the implementation and monitoring of the wellness policy by establishing the what, when, who, and where. It includes all 8 elements of the school wellness policy and a suggested strategy and measurable objective. As mentioned before, under the final rules, schools must inform and update the public about the content of their policies and the status of policy implementation. LEAs must also formally assess their policies to ensure that goals and objectives are being met. With greater transparency on the effectiveness of these policies, parents and the community, as well as other stakeholders, will be better informed and positioned to improve the school nutrition and wellness environment. This document will be shared with you near the link of the recording. Again, it can be used to determine and set objectives for all 8 elements or strategies on implementing items for your wellness policy to ensure that they're measurable. There are a variety of methods that LEAs may employ to assess compliance by schools and determine progress towards benchmarks, objectives, and goals. Developing a wellness policy with measurable objectives and realistic annual benchmarks will help when it is time to evaluate progress. Additionally, the local school wellness policy team and leadership can be assets in conducting periodic assessments. Various resources which have already been identified or developed to support LEAs in their wellness policy process can be found at the USDA School Nutrition Environment and Wellness Resource website, including resources to support LEAs and assess implementation of their school wellness policy can help them move these efforts forward. 2 great tools have been used as resources here in Nebraska. This list is very long, and so instead of reviewing all of the resources, we will encourage you to visit the Team Nutrition website to explore the best assessment tool for your school district or school building. One of the assessment tools that has been used in Nebraska with great success is the Coordinated School Health Index. It is a self-assessment and planning guide. It is an online self-assessment and planning tool that schools can use to improve their health and safety policies and programs. It's easy to use and completely confidential. The School Health Index was developed by the Centers for Disease Control and Prevention in partnership with school administration, staff, school health experts, parents, and the national non-governmental health and education agencies. The goal of which is to ensure that schools are able to identify strengths and weaknesses in health and safety policies and programs, enable schools to develop an action plan for improving student health, which can be incorporated into the school improvement plan, and engaging teachers, parents, students, and the community in promoting health-enhancing behaviors and better health. The School Health Index is based on research and guidelines for school health programs from the CDC, which identifies the policies and practices which are most likely to be effective in reducing youth health risk behaviors. The second tool is the WellSat, or the Wellness School Assessment Tool. It can be used to assess the quality of the school's wellness policy and provides personalized guidance and resources for making improvements. This tool focuses on district-level wellness policies, but it can be easily adapted to measure wellness practices at an individual school. It is an online self-assessment, free and confidential. This tool produces scores from 0 to 100 for both comprehensive and strength for overall school wellness policy. It focuses on the following 6 components: nutrition education, standards for USDA school meals, nutrition standards, PE and PA, wellness promotion and marketing, and evaluation. I've also put together a checklist for school wellness policy annual reports, when you are getting ready for your review. The checklists cover all of the elements required to be included in your school wellness policy documentation. So for the public involvement, you need to report on the following components. Does the district have a wellness committee? Yes or no in the progress area. If not, explain. Has the group worked and helped maintain, revise, implement, assess, and monitor the policy? Yes or no in progress. Participation in Student Wellness Committee is promoted to students, parents, School Food Service Authority, school administrators, school health professionals, and PE teachers, as required by the Wellness Policy Regulation. In regard to nutrition guidelines, you will need to report on the following components. All foods and beverages sold during school between 12 a.m. and 30 minutes after the conclusion of the school day will comply with Smart Snack requirements. The following venues comply with Smart Snack requirements and need to ensure that all food offered through these venues are aligned with Smart Snacks elements. Vending, school stores, fundraisers, concessions, and a la carte. All food and beverages offered through the school lunch program and school breakfast program must also meet nutrition requirements as required by the School Lunch Program Act. For nutrition education, you should include the following information. Students receive nutrition education that teaches the skills needed to adopt healthy eating behaviors. Classroom nutrition information is reinforced in the school cafeteria setting as well as in the classroom. Describe your overall goals and priorities for nutrition education and promotion. Describe your progress towards district nutrition education, classroom instruction, parent education, priorities, goals, measurable goals, and objectives. Nutrition promotion. You must also include information on this element. Reviewing how all foods during the school day are offered to students with consideration for prompting health and re-educating children about obesity. Food and beverages are not offered as a reward for students' performance or behavior, and you must describe your progress towards district nutrition promotion, using smarter lunchroom techniques, increasing school lunch and school breakfast participation, or advertising healthy foods as goals and priorities for the nutrition promotion section. For physical activity and physical education, you must include how you currently provide X number of minutes of recess each day, the total number of physical activity minutes provided for students each day, and if recess is held outdoors, when it can be, and describe your overall goals and priorities for physical activity and promotion, as well as physical activity goals and priorities for the year. For public notification, we regularly, at least annually, inform and update the public about the content, implementation of, and progress toward goals of our wellness policy. Our latest update was done on X date, and you will fill in that information. The district will use electronic and non-electronic mechanisms to inform families of the updates to our wellness policy through email, district website, newsletters, or direct presentations to parents. As far as monitoring and evaluations go, the superintendent or their designee, include the name, ensures compliance with established district-wide nutrition and physical activity wellness policies. We send an annual summary report on district-wide compliance with the established nutrition and physical activities policies to the board, and our latest summary was sent on the specific date that was provided to the school board. Describe your progress towards district goals, priorities, and other school-based activities that promote student nutrition and health. So, what's next? How do we get started? This flowchart can help you decide that. The first step is to assess your wellness policy. See what you're doing well and see what other areas you need to improve on. We just introduced elements of self-assessment and tools you can utilize, such as the School Health Index and the WellSat. Bring members of your school wellness committee together. Discuss what your school is already doing to promote good health and to identify strengths and weaknesses. The School Health Index allows you to assess the extent to which your school implements the types of policies and practices recommended by the CDC. Refer to this webinar to help you select the right types of tools to assess your wellness policy. Now, based on the assessment results, you can decide what areas you need to revise, or if your wellness policy already covers all the required elements. We have introduced many resources, tools, sample policy language in our previous webinars, specifically in Part 2, 3, 4, 5, and 6. All are listed and recorded on the webinars are available on the NDA website. Again, the webinars are provided with many resources included to help you with implementation. After the implementation, you will need to monitor the progress of the policy by identifying strengths and strategies, who is responsible of implementing the policy, by when and how. Refer to your handouts provided to you with the implementation and monitoring success tools. With greater transparency on the effectiveness of these policies, parents and other community stakeholders will be better informed and positioned to work with you to improve school nutrition and the wellness environment. And these are the last steps. You can notify the public via the school's website, emails, letters, flyers, signs in the school's yard, or through press releases to the local media. If you would like to access all of the recorded webinars, slides, and narratives of the webinars, please visit the NDA website under Nutrition Services. Click left and then on the Team Nutrition tab, and it will take you to the Team Nutrition webpage. Click on the National School Lunch Program link. It will then take you to the many projects available under Nebraska Team Nutrition. Then click on the School Wellness link. This will conclude our final webinar. We will send follow-up information as requested. And again, just to remind you, you will contact Zainab Rida, the Nebraska Team Nutrition Director, with any additional questions or comments. Her email is Zainab, Z-A-I-N-A-B, Rida.RIDA@nebraska.gov. Thank you and have a great day.